So we have Dr. Sean Cottrell here from NUYU Weight Loss and Aesthetics, talking about some new things in the office. First of all, thanks for coming in.
Thank you.
Appreciate having you. What's new in the office? You guys you're always coming up with something different.
Well, we started with a weight loss program with Invisared, which is the only one in West Virginia that I'm aware of. We started that about a year ago. Had a little dormant spell for a little while just due to staffing issues, but now we're getting back up and getting started.
A lot of people are having staffing issues, so yeah, you're not alone there.
So for anybody who is interested in maybe getting that done, does it hurt, or what do they need to be prepared for?
That's a good question, yeah.
No, it doesn't hurt at all. There's no stitches, no surgery, no knives. Basically, when you're done with treatment, you can resume normal life. Maybe a little fatigued after the treatment just due to the toxin release that you get afterwards. Other than that, it's perfectly safe and harmless.
So who do you think, or who do you see as being a good candidate for this?
Well, anybody's looking to reduce weight. Of course, anybody who's more closer to their ideal weight, where they have stubborn spots to where exercise and diet doesn't necessarily address it, they will probably see results faster. But anybody that's still overweight will still have significantly good benefits from it, as long as they're in good health and have realistic goals.
Is there something, if somebody is interested in having that done, that they need to prepare for mentally and even physically for it?
The only thing you really need to do is make sure you stay hydrated, 8 to 10 glasses of water a day, maybe even more. But other than that, just get ready, maybe start a little bit of an exercise program and learn to eat a little bit better nutritionally wise.
And talk about how important follow-up is for somebody who goes through this, and that's something that you and your staff are going to address with them, is what to do after they leave your office.
There is a program that you can get on that is like a monthly, once you've achieved the desired results that you're looking at. But the thing is, we do provide a grocery list, a shopping list. We do provide some nutritional assistance. So we try to help them understand how to eat, what to eat, the good things, the bad things, the do's and the don'ts.
Sometimes that's half the battle, is finding how do we make sure that our grocery lists are still as healthy as it can be.
Exactly.
And so if somebody's interested in getting an appointment with you, how can they do that?
All they have to do is call the office. It's NUYU. We're in Cross Lanes, located right beside Cottrell Family Chiropractic, and beside us on the other side is Cookout. Very simple. Pretty much we take same-day appointments. Sometimes we can even do walk-ins.
Yeah, and I think when you are looking at trying to help some of your patients, what's one of the things that you've looked at throughout your career when it comes to helping a person who maybe feels like there is no hope and there is no help, and they probably come into your office? What kind of things do you say to them to prop them up and get them ready to feel better?
Well, being a chiropractor, about 75% of the population, reason why they don't exercise is due to back pain.
Right.
So one of the things that I got to laser for was to think, okay, a lot of people start working out, they either have pain and stop, or two, they don't see results initially, so then they stop. So, and we only treat about 18% of the population. So this is a way to introduce more people to chiropractic to help with back pain, because 80% of people will have back pain throughout their life at some point. And most people don't ever get referred to a chiropractor, or some people just don't even know about it.
Is it fear, do you think? People are afraid to go to the doctor, or they just have given up and they just haven't thought about it?
Lack of knowledge, I think.
Okay.
Really? Wow.
Yeah, I wondered if that was something like that. So acupuncture is also a big part of what you do. Describe, because some people, again, there's that fear of like, oh, needles, I'm terrified of needles. Describe acupuncture as opposed to getting, for example, shots in that you get.
The needles actually are solid, so they actually separate the skin. They don't actually cut the skin like getting a shot or giving blood. The best way I've heard it explained through some of the teachings that I got is we have energy channels throughout the body. When you get a little bit of disturbance in that energy channel, that's disease that will set in. And the needles, you insert them into a point, releases a neurochemical or transmitter, goes back to the brain, and kind of says, there's a reset button, we got a problem here, let's address it.
Yeah, I've never had it before, but it's just something that you consider these kind of things throughout life, but I think who is a perfect person who might be, since we're talking about acupuncture, who's a good person who might benefit from acupuncture?
Basically about anybody, for any condition that they have. Of course, some conditions excluding, but for most part, anybody. I've done it with my children when they were 7 and 8 years old for sinus infections, so anybody can have the acupuncture. You can also do electric acupuncture, so you don't actually use needles also.
All right.
I never knew about that.
How about that?
I'm going to have to ask you a little bit more about that one.
Learn something new every day. So once again, if you want to get in touch with Dr. Cottrell, you can either go to the website, which is cottrellchiropractic.com, or just simply call the number on your screen. And you're located right there in Cross Lanes, easy to find.
Yep.
Off Mountain Road.
Right off the exit.
Well, thanks for coming in.
Thanks so
Not
much.
a problem.
Yeah, we really appreciate it. It's good info.